2003, Jessica Clinton, a Port St. Lucie teenager, died after she went into sudden cardiac arrest during cheerleading practice. A small device, an automated external defibrillator, could have shocked her heart back into rhythm. Since then, Jessica's family worked to pass a law requiring defibrillators in all Florida high schools. Joining us now is Dr. Craig Brodsky of Boca Raton Regional Hospital to tell us more. First of all, thank you so much for joining us.
Sure.
And let's start with the basics. What is sudden cardiac arrest?
Well, sudden cardiac arrest is when someone basically dies unexpectedly, and it's usually caused by an arrhythmia, which is a rhythm disturbance of the heart.
Okay, and how is it different from a heart attack?
A heart attack is often caused by a clogging of the artery when part of the heart muscle is actually injured and damaged. Most of the time people experience chest discomfort or pressure and come into the hospital and get treatment. With a sudden cardiac arrest, people just have an arrhythmia and they just fall. They just pass out unconscious.
And go ahead.
And it happens very unexpectedly, often in previously healthy people.
And so what causes it?
Well, there are many different causes. First of all, a heart attack, a traditional heart attack, can cause sudden cardiac death. But other causes include a disorder of the heart muscle called hypertrophic cardiomyopathy, or some other different types of problems in your heart muscle that you may be born with. There are a variety of other unexpected or rare causes, including drug use, alcohol, and sometimes we just don't know what causes it.
Are there any tests that can be done to find out if a person is at risk?
Well, the problem is it often happens in healthy people, but we typically like to screen, for instance, athletes in high school. Sometimes a physical exam where visiting their pediatrician might detect a problem, a heart murmur might be heard, and an EKG can be a useful screening tool also.
And what are the different types of treatment?
Well, first of all, treatment is limited because you don't really know what's going to happen, and when you have sudden death, unless you're resuscitated and revived within minutes, there's not much we can do. But learning CPR is very important. Having defibrillators available in high schools and in other public places such as airports and movie theaters is a big step, because if people can be resuscitated and treated right away, they can often be saved.
And this can happen to patients of any age, right?
It can. That's the tragic part, is that it's often not only elderly people, but sometimes young people who are thought to be previously healthy.
All right. Well, thank you so much for joining us. We really appreciate it. Boca Raton Regional Hospital sponsors our expert and underwrites Ask the Doctor.